Today, on what would have been the 50th anniversary of Roe v. Wade, I've been invited to speak to you about bodily autonomy. And my aim is to demonstrate that barriers to comprehensive sexual and reproductive health, rights, and justice reflect the value that we as a collective attribute to the lives and to the well-being of communities in conditions of vulnerability by cause of resource-scarce or oppressive settings. Now, from restrictive laws and policies which limit or prohibit access to safe practices of medical and surgical abortion, to a lack of infrastructure to sustain the delivery of pre-exposure prophylaxis and antiretroviral therapy, we are amidst a plight of accountability. Now, I reckon that the most important issues of the 21st century stem from our responsibility to others, whether it be with regards to eradicating poverty and promoting sustainable development, mitigating the consequences of environmental degradation and climate-induced displacement, or ensuring universal healthcare for all. Accountability to a growing world population is a core human rights obligation. It is an approach that is proven to improve outcomes across the board only once we, as duty bearers, are willing to appreciate communities served as rights holders and as partners in informing, designing, implementing, and monitoring program delivery. Over the past 3 decades, 59 countries have liberalized or expanded on their abortion rights across all regions of the world. Young people have been at the forefront of these efforts to promote bodily autonomy, and they represent now an estimated 16% of the world population with 1.2 billion in numbers. Whether through the facilitation of pleasure as opposed to fear-based sexuality education, or in the mobilization of digital health technologies, young people, when given the opportunity to inform sexual and reproductive health programming, can provide a more efficient, a more sustainable, and a more meaningful reach to access care and other forms of support. Now, I stand proudly before you today wearing my green bandana, the universal symbol of solidarity among advocates for abortion rights, a symbol born from Argentina's mothers of the Plaza de Mayo, who gathered before the presidential palace in Buenos Aires in the late 1970s to protest the disappearance of their children under the ruling military junta. They wore white scarves made of cloth used for children's diapers. 2 decades later, the founder of Catholics for the Right to Decide in Argentina called for a national gathering of women to draw attention to bodily autonomy as a core principle of the feminist movement. They wore green bandanas to honor hope, life, and health. And 10,000 women gathered to call and to demand for their right to abortion, to contraception, and to decide when and how many children they chose to conceive. Now, the Green Wave, or Marea Verde, has extended beyond the borders of Argentina since its decriminalization of abortion in 2020 and across Latin America and the Caribbean. Over the course of the past 2 years alone, we have witnessed Colombia's constitutional court become the first of the region to decriminalize abortion up to 24 weeks of gestation. We have witnessed its Truth Commission recognize the sexual and reproductive health and violence that occurred over the course of the country's decades-long armed conflict. We have witnessed Mexico's Supreme Court rule that criminal penalties against abortion were unconstitutional for violating the right to human dignity, autonomy, and equality. We have witnessed Chile's government reform policies to protect against the forced sterilization of those living with HIV. And we have witnessed El Salvador's government adopt structural measures towards banning the criminalization of gestating persons on the basis of obstetric emergencies, following a landmark ruling of the Inter-American Court of Human Rights. Now, I believe that these historical realizations demonstrate that the crisis of accountability in sexual and reproductive health, rights, and justice is manageable, not insurmountable. Despite there being 7 countries in the region that forbid abortion under any circumstances, we have seen this movement grow internationally. And we believe that these effects can continue to ripple out change, and we have good reason to believe so. Over the course of the past year, Sierra Leone's government has shared its intention to unanimously support the adoption of the Safe Motherhood and Reproductive Health Act, a law which would overturn colonial-era criminalization laws, following similar success in Kenya and Benin. In parallel, India's Supreme Court has recently extended abortion rights to all gestating persons, irrespective of marital status, up to 24 weeks of gestation. Now, I want to refer back to this quote by Dr. Talang Mofokeng, who is the first African woman to serve as the UN Special Reporter on the Right to Health. And she writes here that people are not inherently vulnerable. There are situations and there are oppressive systems that then create vulnerable situations that people find themselves in. For me, that has translated in my work by advocating for, implementing, and monitoring various investments and accountability frameworks that inform humanitarian strategies, government policy, and youth programming. It has also meant that I hold a responsibility as a young person in decision-making spaces to represent my community and my community of practice in any contribution that I make, and to bring visibility to the barriers that impede on the sexual and reproductive health and well-being of young key populations. It has also meant that I hold a great deal of appreciation for my peers and my colleagues. And I want to take a moment here to appreciate and to show recognition for their efforts. This is David. David is one of my mentors with whom I work for the World Health Organization's Partnership for Maternal, Newborn, and Child Health. David is an Ecuadorian medical doctor and long-standing advocate for adolescent sexual and reproductive health, as well as meaningful adolescent and youth engagement. Now, David does incredible work, and in particular, he works to systematically integrate young people's partnerships in various decision-making mechanisms. Specifically, he tries to improve health outcomes for adolescent sexual and reproductive health by integrating them in informing, designing, implementing, and monitoring program delivery with the support of multi-generational stakeholder allies. This is Vanessa, to the left. And Vanessa and I work together to inform the operationalization and implementation of various resources that are applied to enable the scaling of youth-led responses in the global HIV/AIDS crisis. Now, Vanessa works in the Asia-Pacific region, specifically in Thailand, where previously, despite significant strides in the country, we have seen that the rate of emerging annual HIV diagnoses was previously represented with half of its percentage being young people. Now, despite, again, the significant strides in which the country's strategic response has added the provision of antiretroviral therapy under its universal health coverage, young people, and young key populations in particular, are left behind due to stigma, discrimination, and limited pediatric care. Vanessa's work is specifically oriented towards facilitating training for healthcare providers and community healthcare workers to ensure that they can actively destigmatize sexually transmitted infections. She facilitates conversation on how we can converge our resources and our knowledge when it comes to family planning, sexual and reproductive health, as well as with the HIV-related programming in the country. This is Sharaf. Sharaf has also provided that same technical support for the AYKP partnership, but he specifically works in facilitating community mobilization in Afghanistan. He works specifically to enable peer-led comprehensive sexuality education in a context in which endemic gender-based violence is deemed to be among the highest in the world. It's also in a context where we have a history of over 4 decades of war, conflict, and insecurity, and where Sharia law has recently been reimposed by the Taliban, where women have no access to secondary or further education, and who have their constitutional and religious rights systematically deprived. And finally, this is Ruin. Ruin and I serve on the board of FOS Feminista, and Ruin, as a young woman of the Middle East and North African region, is a healthcare provider, where she also provides support specifically oriented towards survivors of gender-based violence. But she does so in a way that shifts the focus from healing survivors to ensuring that they are empowered in a nurturing environment. Now, I think that when we speak about sexual and reproductive health, it can be seen as a polarizing discussion, one where a misconception is that it is a partisan issue, whether we speak of abortion, contraception, or gender-based violence. But the truth is that the Green Wave is first and foremost a grassroots movement. It is informed by community needs and by young people. It is informed by the marginalized, and it is informed by those who don't receive the support that they are entitled to by human rights law. And the truth is, yet again, that with the grassroots movement, the accomplishments that we have seen in the Global South relating to bodily autonomy would not have been achieved were it not for the contributions of religious and political leaders from across the spectrum. Bell Hooks once wrote that one of the ways that we sustain ourselves, one of the most vital ways that we sustain ourselves, is by building communities of resistance. She described a vision for reproductive justice in which we have to see beyond individual rights into a world where all people can exercise self-determination and hold onto the social, economic, and political power to make healthy decisions for their bodies, their families, and their communities. That leads me to the second very common misconception, which is that by decriminalizing abortion, we are increasing its commonality. But the truth is that abortion, the need for abortion, the demand for abortion, is measured in millions. It is measured in millions regardless of legality and regardless of accessibility. There's an estimated 25 million abortions that occur each year, with 97% occurring in low and middle income countries. What we hold in our hands is not the outcome of whether or not a woman or other gestating person will seek abortion, because the truth is, whether we can offer it with safe or unsafe conditions is not important. The only outcome that we do hold control over is that of maternal mortality. Now, the war on bodily autonomy is one that is misinformed, but it is one of social, economic, political, and legal efforts meant to undermine the dignity of individuals on the basis of their gestating capacities. The need to learn from the practices of the Global South in terms of upholding models of care for women and other gestating persons has never felt more urgent when we see that over the past century, only a handful of countries have regressed on policies relating to sexual and reproductive health. And those include Nicaragua, Honduras, we have Iran, Poland, and most recently, the United States. The most discerning takeaway across all regions is that sexual and reproductive health is both the most unmet need and the service most likely to be disrupted in conditions of political hostility or resource scarcity. The point that I want to come across the most with this appeal is that the crisis of accountability in sexual and reproductive health, rights, and justice is manageable, not insurmountable, though it will require a universal commitment to confronting, to denouncing, and to divesting the structures that uphold and that perpetuate systemic inequities. What I ask of you is to consider, as a citizen, to vote for politicians that will uphold meaningful accountability frameworks, not just in sexual and reproductive health, but in housing, with the climate crisis, and public policy overall. If you have the time and if you have the capacity, I urge you to consider volunteering your time to proposing a thoughtful and non-judgmental ear, one to support those that are seeking the services to terminate their pregnancy or to take control over their bodily autonomy. And what I ask the most of you, what I urge and what I plead of you, is that if you are invited into a decision-making space of any magnitude, as a young person, I ask that you not compromise your principles and your beliefs and your critical thinking to accommodate those around you. Because the truth is, when you are invited as a young person into a decision-making space of any kind, you are there to serve the purpose of holding those above you accountable to the unmet needs of your community, not to accommodate what is already in place and what is said to alleviate various issues, but rather perpetuates them. Thank you.